Controversial and not widely used 3 years ago, but that has quickly changed. Today it was a hot topic of discussion at the annual meeting of orthopedic surgeons in California. Here in South Florida, it's gaining acceptance and popularity.
Hey Todd, how are you doing?
Good, Dr. Westroff. Good to see you.
Long time
You're
no
going to
see.
shake hands now?
Yes.
Todd Catlett doesn't play tennis, but was suffering from tennis elbow.
I got to the point where I couldn't lift the orange juice out of the refrigerator. I couldn't shake hands with people because the pain was it was excruciating.
After several conventional treatments failed, Dr. David Westerdahl, sports medicine specialist at the Cleveland Clinic, Florida, suggested PRP injections.
It's something where we started using it here in Cleveland Clinic after looking at it carefully, looking at some of the science behind it, making sure that it was safe for patient use.
3 years ago, PRP made headlines when it helped Hines Ward play in the Super Bowl after a knee injury. At that time, Dr. Allen was one of only a few doctors in South Florida doing this. A patient's blood is drawn, then a high-speed spinning process helps separate the components. Plasma with concentrated platelets is injected into the injured site.
And the platelets have growth factors within them. Those growth factors then can help stimulate a local healing response when injected back into damaged tissue.
Catlett is one of the success stories. The pain actually intensifies at first, and it can take months to feel the full effect.
It was probably about 6 weeks, and at that point I felt like nothing had happened. My arm was back to normal.
Dr. Westerdahl says he's had mixed results and it doesn't work for everyone.
There have been some studies that have shown benefit for tennis elbow. There have been studies that have shown that consistently, as well as there have been some studies that have shown it may not work for other areas like rotator cuff related injuries.
Cleveland Clinic doctors are tracking their results. Catlett says his elbow is now back to 100%.
And can shake hands without wincing in pain. So
Now, Medicare does not cover the cost, which is $750 per injection at the Cleveland Clinic. Only about 30% of insurance companies will pay for PRP. Helping you live healthy, Diana Gonzalez, NBC Miami. Adam Cooper.